Hello, everybody. My name is Jocelyn, and for today's presentation, I will be explaining SDG 3, which is health being, and I have chosen to do it in the country of Argentina. So, what is SDG 3? So, their main goal is to ensure healthy lives and promote well being for all at all ages by 2030. Basically, SDG includes improving healthcare access, reducing preventable diseases, supporting mental health, and increasing life expectancy. According to the website or to their website of where all the other SDGs are located, some of their targets include strengthening the prevention and treatment of substance abuse, including narcotic drugs, drug abuse, and harmful use of alcohol, and to achieve universal health coverage and access to safe, effective, quality, and affordable essential medicines and vaccines for all. So, how does the health and the well-being um, in Argentina? So, Argentina has made a lot of progress over the years. They're one of the many few countries that has actually made a significant amount of progress with this SDG. They have made progress in improving public health through their universal healthcare system and national vaccination programs, but they're still not completely there, even though they've made a lot of progress. There's still some challenges that they struggle with. Some of these include unequal access to healthcare between urban and rural areas, rising rates of obesity and diabetes, and periodic outbreaks of diseases such as dengue fever. Um, Life expectancy has also um, is approximately 77 years, and maternal and child mortality has declined over the past few decades as well. So, how does health and wellness differ here in the United States? Well, here in the United States, a whole lot of progress has not been made compared to Argentina. Although the United States is one of the most, spends a whole lot of money on healthcare, um, we still do not have universal health care. It has been said that the United States spends more on health care than any other country, which I actually thought was insane, and yet we still do not have universal health care. Um, it has, however, on I guess the good side, it has advanced medical technology and specialized treatments, but again, it continues to face several challenges, including unequal access to medical services, higher healthcare costs, and mental health is a really big one, especially in young adults. So here are their main differences between the countries. So again, Argentina has universal public healthcare, whereas in the United States they do not. Um, Again, they spend less on healthcare and have lower life expectancy than other countries. United States, on the other hand, theirs isn't as low as Argentina, but it's still considered relatively low. They have the high in the United States. We have the highest healthcare spending worldwide, and we have faster access, but only through private insurance. So my solution was again AI. AI can play a huge role in all of these SDGs, especially as technology continues to grow and advance. Um, so it can help in mental health by having an AI mental health chat box, a 24/7 mental support, emotional support, consultation, something like that, and online counseling referrals. AI can also help improve healthy lifestyles, basically having a plan, an exercise planning, the days to exercise and what to exercise on, diabetes monitoring, and nutrition recommendations, basically getting all our carbs and our natural fats and protein in. AI can also improve with disease prevention. It can predict disease outbreaks, public health alerts, and monitor dengue fever cases. This would play a huge part in Argentina, especially. And lastly, it can help with hospital management. In Argentina, they do struggle having or providing hospitalizations for some of their patients or non-patients. And so AI can definitely help with that. It can help predict the patient demand. It can reduce emergency room wait times, and it can also optimize appointment scheduling. And here are my resources that I used. I hope y'all were able to get a little bit more insight on SDG 30, health and well-being, and how it is and how it differs in Argentina as here in the United States.